618.3, identify the characteristics of a person with an intellectual disability. Mild level, can learn academic, pre-vocational skills and work, might not understand long-term consequences or make appropriate choices, but realizes when they have done wrong, vulnerable to crimes of opportunity. Moderate level, recognizes own needs, but not immediately those of others, can achieve primary education and perform semi-skilled work under supervision, independent in familiar areas, but easily frustrated by change, trouble with chronological description and cause and effect, severe level, slow motor development and communication skills, requires close and constant supervision, like a group home setting, can contribute to self-maintenance, but cannot live independently. Profound level, requires constant care and supervision, may or may not have basic speech. Officers typically deal directly with the caregiver. 618.4, describe how to interact with a person who has an intellectual disability. Refrain from imposing your label upon their disability and always defer to the preferred terminology. Treat them with dignity and respect. Use simple, short sentences to increase likelihood of understanding. Ask them to repeat what they have heard to show they fully understand. Provide additional time to respond to questions. Look for personalized technology or identification that helps contact their caregiver. Be cautious of false confessions, as they may not distinguish between abstract, concrete thought, and they can be easily intimidated and are eager to please authority figures. Refer to DCF, the ARC, or local intake facilities if services are needed. .1 describe some of the characteristics of people who are on the autism spectrum. Language and social development delays and repetitive behaviors, limited eye contact and difficulty responding to questions or directions, repeating words, otherwise known as echoing, engaging in self-stimulating behaviors, stimming, body rocking, hand flapping, skin picking, hair twirling, finger flicking, engaging in self-injurious behaviors, hand biting, self-rubbing, head banging, scratching, trusting nature and inability to understand social norms, making them frequent victims of abuse, neglect, sexual battery, or robbery. 619.2, describe how to interact with a person who is on the autism spectrum. Do not assume their mental capacity. Watch for unusual movements at stressful moments, and be patient if they become upset. Avoid using sarcasm and figurative language. Allow them extra time to answer questions. Clarify what you are saying and check for understanding. Minimize distractions like lights, sirens, large crowds, and barking dogs. Use patience and do not take their behavior personally. Take appropriate steps to ensure safety if self-injurious behavior is recognized. 619.3, describe some safety concerns when taking someone with ASD into custody. Risk of self-injurious behaviors and co-occurring medical issues like seizure disorders. Evaluate the person for any injuries, since indications of pain may not be apparent. Watch for signs of trouble breathing when restrained. Poor muscle tone can pose a risk of positional suffocation. Alert the detention facility that you have a person with ASD in custody so they can take safety steps. 6110.1, identify some of the characteristics of a person with a mental illness. Disturbances in how they process thoughts, emotions, and behaviors, hindrance in their ability to perceive or understand reality. Can occur at any time in a person's life and is not related to intelligence. If they stop taking prescribed psychiatric medications, they display symptoms and are at greater risk of crisis or suicide. 6110.2 identify some of the characteristics of a person with a thought disorder. A disturbance in creating a logical sequence of ideas, appearing as disordered speech or writing, disorganized thoughts that are not logically connected, experiencing hallucinations, hearing, seeing, smelling, tasting, or feeling things not present, experiencing delusions, firmly held false beliefs that are their reality, like believing they're followed by the CIA. 6110.3 identify some of the characteristics of a person with a mood disorder. Emotional disturbances with long periods of excessive sadness, depression, excessive joyousness, mania, or both, which significantly impairs function. Depressive symptoms, multiple major depressive episodes, profound sadness, suicidal ideation, uncontrollable crying, inability to concentrate, eat, or sleep. Manic symptoms, easily distracted, exaggerated sense of self-powers and abilities. 6110.4 identifies some of the characteristics of a person with an anxiety disorder. Frequent, intense, and long-lasting episodes of anxiety that affect daily functioning, panic attack symptoms, racing heartbeat, sweating, tension, chest pain, trembling, choking, a feeling that something terrible is about to happen, or feeling they are going to die. OCD symptoms, uncontrollable, reoccurring thoughts, obsessions, and behaviors, compulsions repeated over and over. 6110.5 identifies some of the characteristics of a person with a personality disorder. Deeply ingrained, non-psychotic, inflexible patterns of relating, perceiving, and behaving that differ noticeably from cultural norms. Anxious, fearful, dramatic, emotional, or unpredictable behavior. Impaired functioning, such as difficulties keeping a job or socializing, lying and exploiting for personal gain or pleasure. Lacking empathy, having no regard for right or wrong, or taking unnecessary risks. (6110.6) describe how to respond to a person with mental illness. Keep everyone's safety in mind and maintain ongoing assessment. Get as much information as possible from dispatch, diagnosed conditions, medications. Speak to family witnesses regarding behaviors, weapons availability, prior law enforcement contact, and history. Only use emergency lights and sirens when urgent response is critical. Emergency equipment can heighten anxiety and hinder calming efforts. Slow down contact and establish yourself as a helper rather than an enforcer. 6110.7 identify how to interact with the person with a mental illness. Exhibit a caring attitude without becoming authoritarian, overbearing, condescending, or intimidating. Avoid basing your interaction on previous contacts with them. Speak at an address appropriate to their age and development. Be empathetic and engage in reflective listening. Ask if they are taking any prescribed or illicit medications and if the dosage is correct. If they have hallucinations, ask what they are hearing or seeing. Example, what are the voices saying? Always maintain situational awareness and consider your safety.